most vulnerable populations, including long-term care residents. I'd like to thank all our frontline healthcare workers, the public health units, and many other partners whose hard work has helped us come this far. Beginning next week, Ontarians will begin receiving a more predictable and increased supply of vaccines from the federal government. This will allow the province and our partners to further accelerate our vaccine rollout and get more shots into arms. This includes a focus on getting vaccines to those most at risk. To that end, the province will increase the supply of COVID-19 vaccines to hotspot communities by over 1 million doses. During the weeks of May 3rd and May 10th, 50% of upcoming vaccine shipments will be dedicated to hotspot communities, administering doses through mobile teams, pop-up clinics, mass immunization clinics, hospitals, primary care, and pharmacies. This targeted, time-limited approach is designed to reduce COVID-19 cases, hospitalizations, and deaths in our most at-risk communities. At the same time, an increased supply of vaccines mean we will not be taking away vaccines from other public health regions. Their allocations will remain the same as previously planned and will increase later in May. More predictable supply from the federal government also allows the province to provide more certainty in its vaccine rollout and when Ontarians can expect to receive the vaccine. To that end, as of April 30th at 8 a.m., individuals aged 55 and over across the province will now be eligible to book their appointment through our provincial booking system. We will continue to expand booking eligibility across the province throughout the month of May, with individuals aged 18 and older eligible to book through the provincial booking system as early as the week of May 24th. This is exciting news. The way out of the pandemic is vaccines, and the light at the end of the tunnel grows brighter every day. However, until the majority of Ontarians have received both doses of the vaccine, we all must continue to follow the public health measures we know work and keep us safe. The best vaccine remains the first one you're offered, and I strongly encourage everyone to book an appointment as soon as their turn. By doing so, we can protect our families, friends, and loved ones and stop the spread of COVID-19. Thank you, and now I'd like to pass it over to Minister Jones.
Thank you, Minister Elliott. Today is very encouraging to be able to state that Ontario is responding to an increase in vaccine supply by ramping up its rollout of COVID-19 vaccines in at-risk communities. In addition to the enhancement just mentioned by Minister Elliott, 16 select pharmacy locations in hotspot communities in Toronto and Peel will begin administering the Pfizer vaccine to individuals aged 55 and above. This will continue to expand to a broader base of communities later in May as supply allows. Currently, pharmacies that are participating in the vaccine rollout across the province are administering the AstraZeneca vaccine to individuals aged 40 and over, and that will continue. As our immunization rollout continues across Ontario, we are determined to get vaccines distributed to as many people as possible in areas where COVID-19 and its variants are spreading most rapidly. That is why, together with our local public health partners, we are using all available vaccine channels to make it as easy as possible for people to get a vaccination. Along with pharmacies, large-scale community clinics, healthcare providers, as well as mobile and pop-up clinics, the addition of employer-operated workplace clinics in hotspot communities announced last week is an impactful step in the expansion of our vaccine rollout. Employers such as Amazon, Maple Lodge, and Maple Leaf Foods are contributing to our collective efforts by protecting their employees, as well as setting up local clinics so residents in at-risk communities have the opportunity to be vaccinated. We will continue to work with prospective employers in the days and weeks ahead in areas where workplace clinics can have the most impact to help stop the spread of COVID-19 and protect communities. We are encouraged by the news that Ontario's vaccine supply from the federal government is expected to increase dramatically in May. With the predictability of supply, we can have predictability of outcomes. There is still a long way to go, and we must continue to do all we can to save lives and reduce hospitalization by staying home and following public health measures. By working together and taking care of each other, we can take these next important steps to keep our loved ones and communities safe. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Randy Rath with CHCH TV. Please go ahead.
Hi, Ministers. Thanks for taking my question. In the technical briefing today, we were told that we're seeing people that have been that have received their first dose contracted COVID is showing up in hospital and ending up in intensive care. Could you shed a little bit more light on that? And is that reason to reconsider the length of time between the first and the second doses?
Well, thank you for your question, Randy. And we know that there are some circumstances where people do contract COVID after having received their first vaccine. However, the clinical evidence shows us that, and this has been recommended by our medical experts, that people do receive a high degree of coverage after the first vaccine, and that if they do need to be hospitalized, it is more likely that they will have only a much milder case of COVID, and that it will reduce hospitalizations and, more importantly, save lives. So at this point, we are not looking at changing our distribution time between the first and second doses. However, with the quantities of vaccines that we are receiving now, we may be able to shorten the time limit somewhat, but that in itself has not caused us to change our decision about the vaccination times in between doses.
Follow up.
Thank you. And I'm also wondering about the lack of AstraZeneca vaccine and if it's going to contribute to people not being able to get their second dose within that 4-month timeline. And also we're waiting for a study that's being done in England to see if we can use an alternative vaccine as the second shot. Is that something that is likely to happen? What do you think of that?
We don't have a definite timeline as of today for distribution of AstraZeneca vaccines or receipt of those vaccines. However, we do expect that we will be receiving them at some point. But what we are doing is to continue with our first vaccination shots for people. And we have a pilot, as was mentioned, to bring forward Pfizer vaccines into pharmacies. This is being done in 16 pharmacies, 8 in Toronto, 8 in Peel, to determine the logistics of this distribution, because we know that the Pfizer vaccine is more sensitive with the storage requirements, deep cold storage, and having as little movement as possible. So we will have vaccines available for people, both in our pharmacies as well as in the mass immunization clinics and the pop-up clinics and in primary care as well.
Next question.
Your next question comes from Lorenda Redikoff with CBC. Please go ahead.
Hi there, Minister. A couple of questions about hot zones. First of all, why is it only 2 weeks that you guys are going to be boosting it up to 50%? And plus, given those long lineups that we are seeing in hot zones, are there going to be attempts to change that?
Thanks for the question. The reason we're focusing for 2 weeks on pushing as much vaccinations and vaccines into the 114 hot zones or hotspot neighborhoods is because we have seen and our science and medical experts have shown us that by putting it where the at risk is highest, we actually protect the largest number of people. And the belief is that by doing it for 2 weeks very aggressively, not taking any vaccines away from the existing other public health units, we can actually really beat down the positivity rates within those communities and ultimately help all of Ontario get back to normal. Thank you.
Follow-up?
It's been weeks since the Premier said that anyone 18 plus in hotspots could get a vaccine. Obviously, that wasn't the case. What's your response to those comments? We're seeing that now it's much later that this will actually be possible.
So to be clear, hotspot FSAs, we call them hotspot neighborhoods, have had with these pop-up clinics the ability for anyone over the age of 18 to receive a vaccine. The difference is that by the middle of May, those over 18 are going to be able to book on the online booking site. So I want people to be clear that 18 and above in a hotspot FSA, when there is a pop-up clinic, when there is an opportunity, absolutely over the age of 18 can have access to a vaccine now. The difference is that by the middle of May, you'll be able to do an online booking of your appointment.
Next question.
Your next question comes from Ryan Tilmelty with National Post. Please go ahead.
Yeah, good afternoon, ministers. I'm wondering about the timelines that you've set between the age brackets between 50 to 40, 40 to 30, et cetera. How did you come up with those numbers? And are you making a decision to open them up, sort of expecting that demand won't be such that everyone in those age brackets tries to book in the first week?
Well, we certainly want people to book as soon as their age bracket becomes available. Because we started at 80 and above, we now have some historical data that allows us to see how quickly, with the vaccine supply that we have and the interest that there is in individuals wanting to get that vaccine, that we believe, coupled with the large increase in supply that we are seeing now coming through in the month of May, that we will be able to go down through those age brackets fairly quickly. And again, really want to encourage people, once you're eligible, whether you're in a hotspot neighborhood or when your age range comes up, please make the booking as soon as you can, because we want to make sure that as many people as possible are protected.
Follow up?
Yeah, I'm just wondering as well, now that you're going to be getting roughly twice the amount of Pfizer vaccines starting next week, in addition to the Moderna vaccines, and then it ramps up again in June, are you comfortable that the Ontario system will be able to roll those out quickly? Do you think you have the resources, the staff, the inoculators in place to do that?
Yeah, it's a really good question. I can assure you that there are 34 public health units that have had a lot of access capacity in terms of wanting to have their clinics open longer, wanting to have them open for more days of the week. So we are confident there, but we are also, as I talked about earlier, working with our larger employees and making sure that when we have health human resources in a company or a business, that we capitalize and use that opportunity to vaccinate those can't work from home employees and their neighborhoods. So we're doing a combination of many different pathways to make sure, and a lot of that planning has already occurred. As you know, of course, Maple Leaf, Maple Lodge began this week. Amazon will start on Monday. And we are working with employers to make sure that as the supply increased, we had these plans in the works. So all of that work has happened. And to answer your question, yes, we are confident that because of the many pathways we have and opportunities for people to access a vaccine, we will be able to get it into people's arms very quickly. Thank you.
Next question.
Your next question comes from Graham Richardson with CTV Ottawa. Please go ahead.
Hi, ministers. To both of you, this is anecdotal, and it's not scientific or empirical in any way, but the reaction to the background briefing materials about expanding the age eligibility, I'm hearing a lot of people saying because of the pharmacy problems, the system is chaotic and it's not working. And how can you do this and expand the age groups because we can't even do what we've started correctly? I'm assuming you're going to have a problem with that perspective, but it is out there from the public. What do you say to people who have joined waiting lists, haven't heard anything, have gone into lines, do not have the shot, and they just don't believe Ontario can pull this off?
Well, we're certainly working with our partners in pharmacies to make sure that they, first of all, have the supplies that they need and that they have the booking system that they need. As you know, people making appointments for vaccinations at pharmacies book directly with the pharmacy. And we are working to make sure that that information is as clear as possible and that people, when they make an appointment and they go and appear for the vaccination, we need to make sure that they have the vaccines available to do that. And with the increased supply that we're receiving over the next several weeks, that will not be a problem. We will be able to keep vaccines supplied, including the pharmacies. They're currently offering vaccines 24/7. We hope to be expanding them as well to make it as convenient as possible for people who may be unable to come in during regular daytime hours in order to receive their vaccines.
Follow up.
The schedule from the federal government showing these numbers, particularly from Pfizer, has been out there for several weeks now. Why is it only today that you are saying supply is coming for May and June? Looking at the federal government and Fortin and the Prime Minister, they've been saying this for weeks, and we've been hearing from the Premier and from your government that supply is just not there. So what changed today that all of a sudden the numbers from the federal government are correct?
Well, we have been anticipating an increase for the last short while. However, we've also seen that there have been supply chain issues with Pfizer during the end of January, first part of February, where our numbers were cut in half, as well as with Moderna. The Moderna shipment has been postponed 3 times, and we are receiving approximately half of what we expected from the original shipment. So we need to make sure that this is absolutely confirmed, because the allocation of doses to the 34 public health units and then their reallocation within their units to the mass immunization clinics and others really depends on that certainty of supply. So we had to do our due diligence, which we did, to make sure that this supply coming in was firm, and we were able to make our plans resulting from that.
Next question.
Your next question comes from Luke Hendry with Intelligencer. Please go ahead.
Hello, and thanks for taking my questions. There are some frontline health workers who aren't yet eligible for their second doses. For example, the hospital teams at Quinte Healthcare, where there's now an outbreak at Bell General, and it's affecting both staff and patients. What do you say to the people on the front lines who are at risk and who are helping to ease the burden on hotspots, yet lack that full protection? And will Ontario provide second doses more quickly for frontline hospital workers?
As Minister Elliott mentioned, as the supply increases, we are looking at whether we can shrink the time between the first dose and the second dose. As you know, we haven't had sufficient supply. And again, medical experts have told us repeatedly that it is far better to vaccinate a larger percentage of the population than to shrink that with the doses. We did that with the clear guidance from the National Advisory Council on Immunizations. But again, I can assure you that if and when we have sufficient supply, we will be looking at moving closer together the first and second dose. But it's really important that we get first doses into as many people who are interested and willing to take it. Thank you.
Follow up? Luke, please go ahead.
Luke, do you have a follow-up?
Yes, thank you. You've said today that areas outside the hotspots will see their vaccine supplies return to higher numbers, what they'd been prior to the decrease. But in Hastings, Prince Edward, that supply is still a third of the capacity to provide that vaccine. Will there be any attempt to further increase the supply to those areas which aren't deemed hotspots, yet are still dealing with much higher transmission rates than they've seen previously?
So as I said previously, most of the 34 public health units actually have plans and capacity to vaccinate a much larger percentage of their population than we have been able to give in terms of the quantity of vaccines. As we said, when we focus for 2 weeks on the 114 high-risk neighborhoods, then the population distribution will go back 100% to by population. And again, that is when communities will see large increases of vaccine supplies, because as you know, right now, we've been 75% by population, 25% by high-risk neighborhoods. We are pushing for 2 weeks 50% of it into the 114 high-risk neighborhoods, and then we will go to 100% by population. So all of the public health units across Ontario will see large increases, and we have been working with them to make sure that when those supplies come in, they're ready to get it into people's arms as fast as possible. Thank you.
Last question.
Your final question comes from Michelle Molesky with CTV News Windsor. Please go ahead.
Hi there. Thanks so much for taking my question. If I'm an 18-year-old and anywhere in Ontario or even a hotspot, and I book an appointment starting May 3rd, how long do you anticipate I'm going to have to wait to actually get my vaccine?
That's a great question, and the short answer is it depends on how many hotspots there are, which public health unit you're in. As you know, many public health units book 2 weeks out, so they plan their clinics and they staff up their clinics, and the appointment booking is 2 weeks out. So if there are other opportunities, like through the pharmacy chain, like through pop-up clinics that are provided in those hotspot FSAs, it could happen very quickly. And it, as I said, it really will depend on what else is happening in that hotspot FSA. We've worked hard to make sure that there are more pharmacy opportunities in the hotspot FSAs and in the public health units. We've made sure that the on-site business and community vaccination pathways that are now coming online, again, are focused and directed to hotspot FSAs, hotspot areas. But it would be challenging to give you an exact timing because each of them are uniquely different.
Follow up, and this is the last question.
At the time of booking, do the people have to provide their postal code right away so that they get rejected from going forward to another appointment, or is it only when you get to the vaccine clinic you have to provide proof of postal code?
For the online and on-call, you provide your postal code and they direct you to all of the options. So the online system and the calling system will tell you these are the clinics that are closest to you, these are the available appointments, and then you choose what is the most convenient for you. Thank you.
Thanks.